Madam President. It is disappointing that the Supreme Court has upheld the constitutionality of the new health care law. Just because it's constitutional doesn't mean it's the best policy, perfect policy, or even good policy. And just because the court upheld the law does not change the fact that the American people have overwhelming concerns about it. Not all of it, but a lot of it. In fact, the court affirmed that the new health care law is a massive tax increase on the American people. Congress must get serious about fixing our broken health care system. We can start by changing this misguided health care law that has divided the American people and failed to address rising health care costs. Congress should work together to make common sense, step-by-step health reforms that can truly lower the cost of health care. I was pleased to see that the Supreme Court narrowed the Medicaid expansion because states can't afford them. Hardworking Americans are still struggling in this anemic economy and need real action to make health care more affordable. Reforms do not have to start here in Washington. Our nation's states are laboratories of democracy and can play a significant role in addressing the health care crisis in America. Governors are in a special position to understand the unique problems facing their states and fixing health care. Like most problems facing our nation, they cannot be a one-size-fits-all solution. Efforts underway by Indiana Governor Mitch Daniels provide a great example of what different states are working on. He's moving forward with Healthy Indiana Initiative, which is an affordable insurance program for uninsured state adults aged 19 to 64. Outside Washington, some health insurance companies have already stated that they will adopt several reasonable provisions to lower health care costs. These include allowing young adults to be covered until age 26 while on the parents' plan, not charging patients co-pays for certain care, not imposing lifetime limits, and not implementing retroactive cancellation of health care coverage. And they said they would do that regardless of how the Supreme Court case came out. One of the most effective ways Congress can address the rising costs of health care is to focus on the way it's delivered as part of the nation's current cost-driven and ineffective patient care system. America's broken fee-for-service structure is driving our nation's health care system further downward, and tackling this issue is a good start to reining in the rising health care costs. What is fee-for-service? This method of payment encourages providers to see as many patients and prescribe as many treatments as possible, but does nothing to reward providers who help keep patients healthy. These misaligned incentives drive up costs and hurt patient care. The new health care law, championed by President Obama and congressional Democrats, did very little to address these problems. The legislation instead relied on a massive expansion of unsustainable government price controls found in that fee-for-service program, especially in Medicare. If we want to address the threat posed by out-of-control entitlement spending, we need to restructure Medicare to better align incentives for providers and beneficiaries. This will not only lower health care costs, it will also improve the quality of care for millions of Americans. In the health care bill, we took $500 billion, $500 billion out of Medicare and put it into new programs. And then we appointed an unelected board to suggest cuts that can be made, and the only place we left for cuts are providers, hospitals, home health care, nursing homes, and hospice. I don't think that's where we want to be cutting Medicare. Shifting the healthcare delivery system from one that pays and delivers services based on volume to one that pays and delivers services based on value is an idea that unites both Republicans and Democrats. We've been mentioning a number of simple steps that can be taken while Congress weighs the larger fixes needed for Medicare. We can encourage insurers to offer plans that focus on delivering healthcare services by reducing copays for high-value services and increasing copays for low-value or excessive services. Consumer-directed health plans provide another avenue for linking financial and delivery system incentives and have the potential to reduce health care spending by $57 billion a year. Bundled payments will support more efficient and integrated care. All these options have already been utilized by a number of private sector firms with great success. The federal government should be willing to support viable reforms where it's needed, but also refrain from handcuffing innovative private sector designs with excessive regulations or narrow political interests. Our nation has made great strides in improving the quality of life for all Americans, and we need to remember that every major legislative initiative that's helped transform our country was forged in the spirit of compromise and cooperation. These qualities are essential to the success and longevity of crucial programs such as Medicare and Medicaid. But when it comes to health care decisions being made in Washington lately, the only thing the government is doing is increasing partisanship and legislative gridlock. I'd like to leave the Senate with some words of wisdom from one of our departed members, and that's Senator Daniel Patrick Moynihan, a Democrat from New York, who served in this body. He said in 2001, shortly before he retired, "Never pass major legislation that affects most Americans without real bipartisan support. It opens the door to all kinds of political trouble." Senator Moynihan correctly noted that the party that didn't vote for it will criticize the resulting program whenever things go wrong. More importantly, he predicted the measure's very legitimacy will be constantly questioned by a large segment of the population who will never accept it unless it's shown to be a huge success. That's a quote from Daniel Patrick Moynihan, former senator. Truer words were never spoken. We've seen each of these scenarios play out over the past 2 years as the new health care law polarized the nation. I hope this distinguished body has the courage to learn from our mistakes, because our nation needs health care reform, but it has to be done the right way. Providing Americans with access to high-quality, affordable health care is something I'm confident Democrats and Republicans should be able to agree on. But 2.5 years ago, a Democrat president teamed up with a Democrat-led Congress with only Democrat votes to force a piece of legislation on the American people that they never asked for and that's turned out to be just as disastrous as predicted. How so? Amid economic recession, a spiraling federal debt, and accelerating increases in government health spending, they proposed a bill that's made the problems worse. Americans were promised lower health care costs. They're going up. Americans were promised lower premiums. They're going up. Most Americans were promised their taxes wouldn't change. They're going up. Seniors were promised Medicare would be protected. It was rated to pay for the new entitlement instead. Americans were promised it would create jobs. The CBO predicts that it will lead to nearly 1 million fewer jobs. Americans were promised they could keep their plan if they liked it. Yet millions have learned that they can't. And the President of the United States himself promised up and down that this bill was not a tax. That was one of the Democrats' top selling points, because they knew it would never get passed if they said it was a tax. The Supreme Court spoke today. It said it's a tax. This law was sold to American people on a deception, but it's not just that the promises about the law weren't kept, it's that it made the problem that it was meant to solve even worse. The supposed cure was proved to be worse than the disease. So it's not just that the promises about the law weren't kept, it's that it has made the problems it was meant to solve even worse. The supposed cure has proved to be worse than the disease. Now, we do pass plenty of terrible laws around here that the court finds constitutional. We need to do some common sense, step-by-step reforms that protect Americans' access to the care they need from the doctor they choose and at a lower cost. And that's precisely what I'm committed to doing. The American people weren't waiting on the Supreme Court to tell them whether they supported this law. That question was settled 2.5 years ago. The more the American people have learned about this law, the less they've liked it. So now that the court has ruled, it's time to move beyond the constitutional debate and focus on the primary flaws, because this colossal damage that it's doing and has already done to the healthcare system and to the economy and to the job market needs to be turned around. There are things that need to be done and can be done. I yield the floor and suggest the absence of a quorum.